to make a difference for a particular child, the doctor is only one part of that. So to make a difference, you have to deliver good teamwork. So in developing disability services in Lewisham, which really has been my whole kind of career trajectory, it was to knit together the family health, mental health, social care, education, and the voluntary sector, and primary care within health. And that, if you've got some kind of teamwork going around that with the family involved in that teamwork, you had a chance of delivering to them the kind of support network that allowed them to live their lives. If we fast forward to today, the powers that be, NHS England, Simon Stevens, of course, Jeremy Hunt, they all talk about integration, but they're not interested in the delivery, I don't think, delivery at the point of the family's need. They're talking about structurally merging bodies, weakening the power of the influence of individual professions, whether you're a social worker or you're a teacher or you're a nurse or a doctor, stripping down the budgets and actually making delivery of good integrated care impossible. You know that my own involvement in national NHS politics came through the Save Lewisham Hospital campaign. And there, having spent 20 years building up integrated care for children, which knitted together the hospital and care in the community in health alongside the other agencies, along comes Jeremy Hunt to threaten to shut down the hospital right in the middle of this network and to threaten to close it down virtually overnight. And that was going to shatter what we'd built up for 20 years. The funding for the health service in the UK has just been very, very much below what you expect for an advanced nation. This is the 5th or 6th richest economy, and we have less doctors and less nurses trained than France and Germany, than the advanced economies in Europe. And if we were to demand and to win the funding of the health service, even if it was just on the average of the health systems in Europe, we would be in a much, much stronger position to train enough nurses, train enough doctors, and not close units for financial reasons. And I'm saying that because, you know, as a doctor and as someone in the health service, we've never opposed change where there's really good clinical evidence for it. From the beginning of the health service in 1948, the responsibility for this wonderful social service of health for all, universally provided, comprehensive in its content, the responsibility for that lay with the Secretary of State for Health and the government was accountable to Parliament and to the people at elections. And with the Health and Social Care Act in 2012, which was implemented April 2013, 3 years ago, that direct responsibility of the Secretary of State was broken. He can wash his hands of responsibility when it comes down to the funding and the actual delivery of healthcare. What they did was they built many hospitals around the country that was based on funding raised from the private sector, with incredibly lucrative contracts to the private sector. And they were giving private PFI companies contracts of 30 or up to 60 years, where they in effect owned the hospital premises, and the NHS was paying exorbitant amounts of money that was the equivalent of 7 times the original loan. So people who are fortunate enough to have a car on lease or have a house on a mortgage, you may expect to pay perhaps 2 or 3 times the original loan, but the hospital sector was paying 7 times its original loan. They brought McKinsey in to run this process, and I was one of the consultants amongst many that were dragooned into going to these engagement meetings. And so I actually know that, again, it's not conjecture, I know that they were saying that McKinsey was preaching that 30% of hospital-based care could be dealt with in the community. So what you have now, and this is important because this is government methodology. They started off with their decision to close Lewisham Hospital. They then had to construct a justification for that, which was that we didn't really need a hospital because 30% of people would be looked after in the community. And then they had to invent ways of caring for that 30% that the public would buy. Private companies are interested in getting a big chunk of the NHS budget, and therefore they are swarming around the NHS. If they deliver the same service as the NHS does, then they can't do it cheaper, in my view, without driving down the wages of people, which ultimately will de-skill them because people with less skills will apply for those jobs, or by transferring down a chain services that a doctor should deliver starting to be delivered by a nurse, or what a nurse should deliver as part of his or her core job as a trained nurse being passed down to a healthcare assistant, or the healthcare assistant's areas of responsibility being actually transferred back to the family or the community. You look after yourself, or you look after your family members. So there's a chain of delegating away from where the service should be delivered down a chain, and you're de-skilling the service, and you're basically changing its quality. So the health service is a very efficient service. It's of course not perfect, and least of all now when it's underfunded, but it's a very, very efficient service, as we know from international studies. So I think the answer is that a private service cannot deliver the same quality of care without taking measures to undermine it, and that's not sustainable. The other way of a private service coming in and providing a service is to start rationing it and saying, well, it isn't universally available. And that is another route that the clinical commissioning groups are starting to use more and more. So you might say you'll only have 1 hearing aid and not 2, or you'll only have 1 cataract done and not 2, or you've had 1 hip operation but you're not getting another one, or stringing out the length of time waiting, deeming some services not to be essential health measures like vasectomy or varicose veins operations. So you can then privatise a service. You can do what I've just said on the NHS and ration it, because clinical commissioning groups are now able to make those decisions. But you can also make a service privatised and let it run a ration service. So the private healthcare service is very inefficient financially. Ideologically, it isn't as committed to the general public good as the health service, and ultimately it is part of a service that is there for the profit motive, which means that you're more likely to be given care that you don't need if you have to pay for it, or you're being given care in an isolated form that isn't part of a multidisciplinary team and joined up with other agencies. So it's got huge problems when private care starts to be delivering core NHS services. We are in real trouble. The difficulty for the public, of course, is that they're receiving services that they need, and they will see the NHS logo on a letterhead or on the side of an ambulance, and they won't necessarily know that that part of the NHS service is being provided by a private company. And that is a real problem, because that has eroded whole chunks of the NHS bit by bit without people realising it. There are lots of examples where with the financial pressure on the NHS, individual trusts say, well, we can only afford this if we go down the private company route, and of course they do that by driving the wages down. So you see an ambulance service that's Group 4S to ferry patients from one hospital site to another, or to take them home from an outpatient appointment to home, because that's not part of the emergency ambulance service. And trusts will often be giving that contract to a private company, but you'll see NHS on the side of the ambulance. And what you don't get, of course, is the NHS ethos that's a very strong part of the 1.3 million people that work for the NHS, that they're offering an essential community public service to keep people healthy or to help them when they're ill. Of course, if the only way you can have an MRI scan is through the NHS in a private scanner, then that's not your individual responsibility to refuse it. That would be crazy if you refuse it. But being part of a campaign to roll that back is a great thing. And of course, the argument that the private sector provides scanners more efficiently is nonsense. They only provide scanners more efficiently is because they've got the money to buy them. And the NHS is forcing patients to go down that route. If the NHS bought scanners, they'd be cheaper than in the private sector, and there's no reason why we shouldn't have the capacity to provide them with very short waiting lists. The government brought in chaos into the health service and an inability to have conversations between providers and health providers and social care providers. So the NHS England's latest plan is they've divided England into 44 areas called footprints, and they are telling those areas in quite a dictatorial way that this group of providers, this group of social care, local authority providers, and the commissioners will all be now part of one quasi-organisational structure called a footprint, and you will develop a 5-year sustainability and transformation plan. Is two things. One is to attempt to transform services to force local authorities and health to work together, some of which has to be seen as something on a level playing field with adequate funding, and a lack of ideology to privatise would have to be a good thing. But doing it at a time when there's no funding, local authority spending is being slashed, and they are driving through things that say care in the community is the way out of jail for overburdened A&Es and hospitals, and saying that we can go back to this McKinsey formula that 30% of healthcare will be looked after in the community. the government is saying, or the NHS England is saying, that changes haven't come quickly enough, and we will force social care and health to work together to deliver care in the community. There's no way around it that we have to organise together. Individually, you can do things like writing to your local MP and all that, the long list of the usual things. Go to your council and go to your CCG board meetings. Those things are very important. But even then, you need the evidence that you observe in those meetings. You need to bring it back to a group, and you need to share that and share the intelligence. And that group needs to share the intelligence with the adjacent group. Ealing, Hammersmith, and Charing Cross have been working so well together. Lewisham and Lambeth working together about our local South East London. We have to have insight into what the real issues are. We have to know our health service. We have to have some idea of what health service we want, and be able to take on the arguments of whether it's Simon Stevens or Jeremy Hunt. Like the junior doctors have challenged the 7-day NHS business as nonsense. Most of the time, a lot of the time it's not needed, and where it is needed, it's got to be funded. So you have to know your facts. I think clinical staff, NHS staff, have a responsibility to get involved with community campaigns, and we were fortunate to have that in Lewisham. And to lobby the professional bodies, the Royal Colleges, and to say that our health service is very, very much in danger, and it's in danger now. Keep Our NHS Public is an organisation that, as you know, I'm co-chair of, and it was set up in 2005 during the Labour government, where a group of people realised that the early privatisation of the health service was a very dangerous direction of travel. There are many other organisations, but Keep Our NHS Public is well established, and it has 65 branches, if you like, affiliated groups around the country. I really feel we've got a responsibility to work together now, keep Our NHS Public with other groups. It would be great if they merged together and brought that strength of unity. But if they don't merge organisationally, we've got to cooperate in action. So Keep Our NHS Public promoted something called Health Campaigns Together, which we launched in the autumn last year. And there's about 25 different organisations are affiliated now to Health Campaigns Together, of which Keep Our NHS Public is one, and it has been the leading force. And I think that's a very important step forward. And I think we need to continue to do that, and we're strengthening our structure a little bit. We've got a website, we've a newspaper now. You've got one there. The third issue has just come out. We, as an alliance, as a broad, as a united front, if you like, as an alliance, we supported some of the junior doctor struggle, the NHS bill when it was presented in March. The thing that I would say is we've got to be as well organised as the government and the Conservatives are. They're full of divisions, but they unite ideologically to attack public sector services, education, social care and health. We have to be, at least have to try to be as united as they are in defending our public sector services as they are in attacking it. And I just my plea is that people come together and drop any sectarian divisions or ideological divisions and unite on what we can unite on. And that's so important, because the time is ticking away and we won't have our health service forever unless we act very quickly.